published this paper in Journal of Thrombosis and Thrombolysis this year. It was published in February 2023. We have done additional analysis after the real-life data that we had from our two previously published real-life data about the Idarucizumab use in patients with acute ischemic stroke, and also about Idarucizumab use in patients with hemorrhagic stroke, with intracranial bleedings. And we have wrote this paper together with Pavel Kermer, with a German neurologist. So we actually updated the literature about the case reports and also case series after the published two papers, and also all the additional articles showed that it is safe and that it is also effective to use Idarucizumab before IVT, and that also in patients who suffer intracranial bleedings on Dabigatran, it is also effective to use Idarucizumab in those patients. And additionally, we have did also the whole analysis of the systematic reviews that were published according to the IVT, and also about the intracranial bleedings. And the majority of the review articles are definitely to use the Idarucizumab before IVT and also in patients with intracranial bleedings. About the IVT, we have also very nice editorials and the leading papers. And maybe just to mention, there are also some nice case reports about use of Idarucizumab in patients with acute stroke already in the mobile stroke units. So this is also a very nice topic to discuss about, and all the cases that were published about giving Idarucizumab in mobile stroke units were very encouraging. So the application in those patients was safe. This is very important, and it was also effective. So at the end, we proposed an SOP, so the standard operational procedure, how to manage with patients on Dabigatran who are presenting with signs and symptoms of an acute ischemic stroke. So if we don't know if the patient took the Dabigatran, or if we don't know when the patient took the last dose of Dabigatran, or when we know that the levels of Dabigatran, so like the hemoclot or the APTT, are elevated, so the patient is more than obviously anticoagulated with Dabigatran, and if we know that the patient took Dabigatran in the previous 48 hours, we advise to give the patient Idarucizumab before IVT in the standard dose of 5 gram IV. And of course, the patient the patient must have all the criteria. So the patient must be eligible for the IVT without any other contraindications. If there is the occlusion of large artery, large vessel, intracranial, also the endovascular therapy is of course indicated, and all those patients must be admitted to the stroke units according to the guidelines. In patients who suffer intracranial bleedings, again, if the patient took Dabigatran in the previous 48 hours, or if the laboratory exams like APTT or hemoclot are elevated. And of course, we also must have the impaired renal function. It is suggested to use the Idarucizumab, again, in the dose of 5 gram IV. And then, of course, also, if applicable or if it is indicated, do the surgical evacuation, but it depends on the location of intracranial bleedings. And again, the patient must be admitted to the stroke unit. So this is actually a very nice paper with all the recent data about the treatment of patients who suffer acute ischemic stroke or intracranial bleedings on Dabigatran, and how to manage those patients.